Opening credits. Cognitive Behavioral Therapy, Workbook for Brain Development and Psychotherapy. Written by Gordon Bowles. Narrated by Rick Parody. Cognitive Behavioral Therapy, Workbook for Brain Development and Psychotherapy. By Gordon Bowles. Introduction. Cognitive behavioral therapy is an approach used by psychotherapists to influence a patient's behaviors and emotions. The key to the approach is in the procedure, which must be systematic. It has been used successfully to treat a variety of disorders, including eating disorders, substance abuse, anxiety, and personality disorders. It can be used in individual or group therapy sessions, and the approach can also be geared towards self-help therapy. Cognitive behavioral therapy is a combination of traditional behavioral therapy and cognitive therapy. They are combined into a treatment that is focused on symptom removal. The effectiveness of the treatment can clearly be judged based on its results. The more it is used, the more it has become recommended. It is now used as the #1 treatment technique for post-traumatic stress disorder, obsessive-compulsive disorder, depression, and bulimia. Cognitive behavioral therapy first began to be used between 1960 and 1970. It was a gradual process of merging behavioral therapy techniques and cognitive therapy techniques. Behavioral therapy has been around since the 1920s, but cognitive therapy was not introduced until the 1960s. Almost immediately, the benefits of combining it with behavioral therapy techniques were realized. Ivan Pavlov, with his dogs who salivated at the ringing of a dinner bell, was among the most famous of the behavioral research pioneers. Other leaders in the field included John Watson and Clark Hull. Instead of focusing on analyzing the problem like Freud and the psychoanalysts, cognitive behavioral therapy focused on eliminating the symptoms. The idea that if you can eliminate the symptoms, you have eliminated the problem. This more direct approach was seen as more effective at getting to the problem at hand and helping patients make progress more quickly. As a more radical aggressive treatment, behavioral techniques dealt better with more radical problems. The more obvious and clear-cut the symptoms were, the easier it was to target them and devise treatments to eliminate them. Behavioral therapy was not as successful initially with more ambiguous problems such as depression. This realm was better served with cognitive therapy techniques. In many academic settings, the two therapy techniques were used side by side to compare and contrast the results. It was not long before the advantages of combining the two techniques became clear as a way of taking advantage of the strengths of each. David Barlow's work on panic disorder treatments provided the first concrete example of the success of the combined strategies. Cognitive behavioral therapy is difficult to define in a succinct definition because it covers such a broad range of topics and techniques. It is really an umbrella definition for individual treatments that are specifically tailored to the problems of a specific patient. So the problem dictates the specifics of the treatment, but there are some common themes and techniques. These include having the patient keep a diary of important events and record the feelings and behaviors they have in association with each event. This tool is then used as a basis to analyze and test the patient's ability to evaluate the situation and develop an appropriate emotional response. Negative emotions and behaviors are identified as well as the evaluations and beliefs that lead to them. An effort is then made to counter these beliefs and evaluations to show that the resulting behaviors are wrong. Negative behaviors are eliminated, and the patient is taught a better way to view and react to the situation. Part of the therapy also includes teaching the patient ways to distract themselves or change their focus from something that is upsetting or a situation that is generating negative behavior. They learn to focus on something else instead of the negative stimulus, thus eliminating the negative behavior that it would lead to. The problem is essentially nipped in the bud. For serious psychological disorders like bipolar disorder or schizophrenia, Mood-stabilizing medications are often prescribed to use in conjunction with these techniques. The medications give the patient enough of a calming effect to give them the opportunity to examine the situation and make the healthy choice, whereas before they could not even pause for rational thought. Cognitive behavioral therapy has been proven effective for a variety of problems, but it is still a process, not a miracle cure. It takes time to teach patients to understand situations and identify the triggers of their negative behaviors. Once this step is mastered, it still takes a lot of effort to overcome the first instincts and instead stop and make the right choices. First, they must learn what they should do, and then they must practice until they can do it. Chapter 1. What constitutes cognitive behavioral therapy? Cognitive behavioral therapy is a psychotherapeutic approach that aims to teach a person new skills on how to solve problems concerning dysfunctional emotions, behaviors, and cognitions through a goal-oriented systematic approach. This title is used in many ways to differentiate behavior therapy, cognitive therapy, and therapy that is based on both behavioral and cognitive therapies. There is empirical evidence that shows that cognitive behavioral therapy is quite effective in treating several conditions, including personality, anxiety, mood, eating, substance abuse, and psychotic disorders. Treatment is often manualized, as specific psychological orders are treated with specific technique-driven brief, direct, and time-limited treatments. Cognitive behavioral therapy can be used both with individuals and in groups. The techniques are often adapted for self-help sessions as well. It is up to the individual clinician or researcher on whether he or she is more cognitive-oriented, more behavioral-oriented, or a combination of both, as all three methods are used today. Cognitive behavioral therapy was born out of a combination of behavioral therapy and cognitive therapy. These two therapies have many differences, but found common ground on focusing on the here and now and on alleviating symptoms. Evaluating cognitive behavioral therapy has led to many believing that it is more effective over psychodynamic treatments and other methods. The United Kingdom advocates the use of cognitive behavioral therapy over other methods for many mental health difficulties, including post-traumatic stress disorder, obsessive-compulsive disorder, bulimia nervosa, clinical depression, and the neurological condition chronic fatigue syndrome, myalgic encephalomyelitis. The precursors of cognitive behavioral therapy base their roots in various ancient philosophical traditions, especially Stoicism. The modern roots of CBT can be traced to the development of behavioral therapy in the 1920s, the development of cognitive therapy in the 1960s, and the subsequent merging of the two therapies. The first behavioral therapeutic approaches were published in 1924 by Mary Coverd Jones, whose work dealt with the unlearning of fears in children. The early behavioral approaches worked well with many of the neurotic disorders, but not so much with depression. Behavioral therapy was also losing in popularity due to the cognitive revolution. This eventually led to cognitive therapy being founded by Aaron T. Beck in the 1960s. The first form of cognitive behavioral therapy was developed by Arnold A. Lazarus during the time period of the late 1950s through the 1970s. During the 1980s and 90s, cognitive and behavioral therapies were combined by work done by David M. Clark in the United Kingdom and David H. Barlow in the United States. Cognitive behavioral therapy includes the following systems: cognitive therapy, rational emotive behavior therapy, and multimodal therapy. One of the greatest challenges is defining exactly what a cognitive behavioral therapy is. The particular therapeutic techniques vary within the different approaches of CBT depending upon what kind of problem issues are being dealt with, but the techniques usually center around the following. Number 1. Keeping a diary of significant events and associated feelings, thoughts, and behaviors. Number 2. Questioning and testing cognitions, evaluations, assumptions, and beliefs that might be unrealistic and unhelpful. Number 3. Gradually facing activities that may have been avoided. Number 4. trying out new ways of behaving and reacting. In addition, distracting techniques, mindfulness, and relaxation are also commonly used in cognitive behavioral therapy. Mood-stabilizing medications are also combined with these therapies to treat conditions like bipolar disorder. The NICE guidelines within the British NHS recognize cognitive behavioral therapy's application in treating schizophrenia in combination with medication and therapy. Cognitive behavioral therapy usually takes time for patients to effectively implement it into their lives. It usually takes concentrated effort for them to replace a dysfunctional cognitive affective behavioral process or habit with a more reasonable and adaptive one, even when they recognize when and where their mental processes go awry. Cognitive behavioral therapy is applied to many different situations, including the following conditions: anxiety disorders, obsessive-compulsive disorder, social phobia or social anxiety, generalized anxiety disorder. Mood disorders, clinical depression, major depressive disorder, psychiatric symptoms. Insomnia, including being more effective than the drug Zopiclone. Severe mental disorders, schizophrenia, bipolar disorder, severe depression. Children and adolescents, major depressive disorder, anxiety disorders, trauma and post-traumatic stress disorder symptoms. Stuttering, to help them overcome anxiety, avoidance behaviors, and negative thoughts about themselves. Cognitive behavioral therapy involves teaching a person new skills to overcome dysfunctional emotions, behaviors, and cognitions through a goal-oriented, systematic approach. There is empirical evidence showing that cognitive behavioral therapy is effective in treating many conditions, including obsessive-compulsive disorder, generalized anxiety disorder, major depressive disorder, schizophrenia, anxiety, and negative thoughts about oneself. With the vast amount of success shown by the use of this therapy, it is one of the most important tools that researchers and therapists have to treat mental disorders today. Chapter 2: Cognitive Behavioral Therapy, the Basics. Cognitive behavioral therapy is a form of psychotherapy that emphasizes the important role of thinking in how we feel and what we do. Cognitive behavioral therapy does not exist as a distinct therapeutic technique. The term cognitive behavioral therapy, CBT, is a very general term for a classification of therapies with similarities. There are several approaches to cognitive behavioral therapy, including rational emotive behavior therapy, rational behavior therapy, rational living therapy, cognitive therapy, and dialectic behavior therapy. However, the most cognitive behavioral therapies have the following characteristics. Number 1. CBT is based on the cognitive model of emotional response. Cognitive behavioral therapy is based on the idea that our thoughts cause our feelings and behaviors, not external things like people, situations, and events. The benefit of this fact is that we can change the way we think to feel/act better even if the situation does not change. Number 2. CBT is briefer and time-limited. Cognitive behavioral therapy is considered among the most rapid in terms of results obtained. The average number of session clients receive across all types of problems and approaches to CBT is only 16. Other forms of therapy, like psychoanalysis, can take years. What enables CBT to be briefer is its highly instructive nature and the fact that it makes use of homework assignments. CBT is time-limited in that we can help clients understand at the very beginning of the therapy process that there will be a point when the formal therapy will end. The ending of the formal therapy is a decision made by the therapist and client. Therefore, CBT is not an open-ended, never-ending process. Number 3. A sound therapeutic relationship is necessary for effective therapy, but not the focus. Some forms of therapy assume that the main reason people get better in therapy is because of the positive relationship between the therapist and client. Cognitive behavioral therapists believe it is important to have a good, trusting relationship, but that is not enough. CBT therapists believe that the clients change because they learn how to think differently, and they act on that learning. Therefore, CBT therapists focus on teaching rational, self-counseling skills. Number 4. CBT is a collaborative effort between the therapist and the client. Cognitive behavioral therapists seek to learn what their clients want out of life, their goals, and then help their clients achieve those goals. The therapist's role is to listen, teach, and encourage, while the client's role is to express concerns, learn, and implement that learning. Number 5. CBT is based on Stoic philosophy. Not all approaches to CBT emphasize Stoicism. Rational emotive behavior therapy, rational behavior therapy, and rational living therapy emphasize Stoicism. Beck's cognitive therapy is not based on Stoicism. Cognitive behavioral therapy does not tell people how they should feel. However, most people seeking therapy do not want to feel the way they have been feeling. The approaches that emphasize Stoicism teach the benefits of feeling, at worst, calm when confronted with undesirable situations. They also emphasize the fact that we have our undesirable situations, whether we are upset about them or not. If we are upset about our problems, we have two problems: the problem and are upset about it. Most people want to have the fewest number of problems possible. So when we learn how to more calmly accept a personal problem, not only do we feel better, but we usually put ourselves in a better position to make use of our intelligence, knowledge, energy, and resources to resolve the problem. Number 6. CBT uses the Socratic method. Cognitive behavioral therapists want to gain a very good understanding of our clients' concerns. That's why they often ask questions. They also encourage their clients to ask questions of themselves like, how do I really know that those people are laughing at me? Could they be laughing about something else? Number 7. CBT is structured and directive. Cognitive behavioral therapists have a specific agenda for each session. Specific techniques/concepts are taught during each session. CBT focuses on the client's goals. We do not tell our clients what their goals should be or what they should tolerate. We are directive in the sense that we show our clients how to think and behave in ways to obtain what they want. Therefore, CBT therapists do not tell their clients what to do, rather, they teach their clients how to do. Number 8. CBT is based on an educational model. CBT is based on the scientifically supported assumption that most emotional and behavioral reactions are learned. Therefore, the goal of therapy is to help clients unlearn their unwanted reactions and to learn a new way of reacting. Therefore, CBT has nothing to do with just talking. People can just talk with anyone. The educational emphasis of CBT has an additional benefit. It leads to long-term results. When people understand how and why they are doing well, they know what to do to continue doing well. Number 9. CBT theory and techniques rely on the inductive method. A central aspect of rational thinking is that it is based on fact. Often, we upset ourselves about things when, in fact, the situation isn't like we think it is. If we knew that, we would not waste our time upsetting ourselves. Therefore, the inductive method encourages us to look at our thoughts as being hypotheses or guesses that can be questioned and tested. If we find that our hypotheses are incorrect because we have new information, then we can change our thinking to be in line with how the situation really is. Number 10. Homework is the central feature of CBT. If when you attempted to learn your multiplication tables, you spent only 1 hour per week studying them, You might still be wondering what 5 times 5 equals. You very likely spent a great deal of time at home studying your multiplication tables, maybe with flashcards. The same is the case with psychotherapy. Goal achievement, if obtained, could take a very long time if all a person were only to think about the techniques and topics taught was for 1 hour per week. That's why CBT therapists assign reading assignments and encourage their clients to practice the techniques learned. Chapter 3: Understanding the Fundamentals of Cognitive Behavior Therapy. Cognitive behavior therapy has been used to help patients who are suffering from depression, anxieties, addictions, and all sorts of other psychosocial problems. When undergoing cognitive behavior therapy, a professional helps the suffering person to readjust his or her thinking. It is believed that thinking patterns and the way a person may perceive or relate to certain situations are connected with the patient's emotions and behavior. Cognitive behavior therapy is a way to help find the underlying causes of the problem from a psychological point of view, and then change or correct the thinking pattern that has led to wrong behavior. Using cognitive behavior therapy, a professional is trying to modify the unrealistic and distorted thinking of the patient. This in turn will help the patient to make changes in behavior and to be able to readjust. Thinking patterns and emotions play a key role in human behavior and can be changed or modified. Cognitive behavior therapy is also used to help people with drug addictions such as cocaine. In the strictest sense of the word, people who turn to drugs, both legal prescription drugs that are addicting as well as illegal drugs, can be said to have a behavior disorder and can benefit from cognitive behavior therapy. There are an increasing number of people who are suffering from dysfunctional disorders, and while some believe medical treatments may be enough, studies seem to indicate that cognitive behavior therapy is successful. Of course, a lot depends on the person's willingness to comply with a trained therapist and to modify inner thoughts and feelings. The trained therapist also is helping the patient to understand past experiences and situations, to analyze and to learn not to react in an irrational or distorted way. Cognitive behavior therapy has become a way of understanding the connection between inner thoughts and perceptions and human behavior. This, no doubt, has contributed to some success that has been made. It has also helped some people to make big changes in their life. If you are a person who is suffering from anxiety or depression, or any other kind of psychosocial problem, take courage and find a trained therapist in cognitive behavior therapy. You can learn to make changes in your life and help yourself and those who are close to you. Of course, it may take you some time to see a difference in your life, but remember, to accomplish anything worthwhile, you need determination. There are also many books written on this subject that you may want to check out. When going online, you can also find tons of information that may help you to learn even more about cognitive behavior therapy. The time you may spend can make the difference. The good news is that, even if you feel overwhelmed and discouraged at times, there is help for you. There is also help in the form of seminars that you can attend to learn more about cognitive behavior therapy and how it can help you. Taking time to look over the information available can be your very first step to recovery. Chapter 4: Cognitive what? Cognitive behavioral therapy. Cure your anxiety condition. There is a permanent cure for a wide range of anxiety conditions, including panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, generalized anxiety disorder, social anxiety disorder, and phobias. According to the National Institute of Mental Health, NIMH, anxiety disorders plague 40 million American adults, ages 18 and older. As we mull over significance of that staggering number, let's have a look at the recommended method of treatment, one that's provided recovery for hundreds of thousands of sufferers. Cognitive behavioral therapy is actually a merging of two distinct therapies, both of which trace their roots back to the 1950s and 1960s, and their acceptance by the medical establishment to the 1970s and 1980s. Cognitive therapy was developed during the 1960s by American psychiatrist Aaron T. Beck. Beck originally applied his approach to matters of depression, then expanded his practice to include anxiety disorders. How is it that people interpret their daily lives and assign meaning is a process called cognition. Beck, disillusioned with traditional psychotherapeutic delving into the subconscious, concluded that cognition, what his patients perceived, was the key to effective therapy that would lead to reliable recovery. When developing his therapy, Beck first observed that depressed people adopt a negative perception of the world during formative years, based on the loss of a loved one, peer rejection, criticism by authority figures, depressed attitudes present in significant others, plus a host of random negative events. Most often, this negative perception is fed and nurtured by a biased, emotional view of the world. For example, all-or-nothing thinking, overgeneralization, and selective perceptions that exclude vital, meaningful information. Cognitive therapy postulates that distortions in a person's perspectives grow into disorders. It is the job of a cognitive therapist to point out these distortions and encourage change in a sufferer's attitude. Behavior therapy made its debut back in 1953 in the United States in a research project headed by B.F. Skinner. In South Africa, Joseph Wolpe and his research group is credited with pioneering work. In the United Kingdom, Hans Eysenck contributed to the development of this type of therapy. Behavior therapy relies primarily on functional analysis. Behavioral therapists have successfully been used as a treatment for intimacy problems, chronic pain, stress, anorexia, chronic distress, substance abuse, clinical depression, and anxiety. Behavior therapy is data-driven and contextual, concentrating on the environment and its context. Primarily, behavior therapy is concerned with the effect or consequence of a behavior. Behavior is viewed as statistically predictable. A person is treated as a whole, without the distractions of a mind versus body approach, but relationships, bidirectional interactions, are well taken into account. Originally, anxiety conditions were viewed as byproducts of chemical imbalances and/or genetic predispositions. As these notions were abandoned, learned behaviors were credited as the source of most anxiety conditions. Hope for a permanent cure emerged, and in the 1990s, cognitive therapy and behavioral therapy merged into cognitive behavioral therapy, CBT. The common ground for these two therapies is emphasis on the here and now by focusing on alleviating symptoms and replacing harmful, self-destructive behavior with beneficial beliefs and attitudes. In the United Kingdom, the National Institute for Health and Clinical Excellence recommends CBT as preferred treatment for mental health difficulties such as OCD, post-traumatic stress disorder, bulimia, clinical depression, and even for the neurological condition chronic fatigue syndrome. In the United States, in spite of our obsession with pharmaceutical solutions, CBT has received acceptance within the medical establishment. Skilled, results-driven help is available for sufferers who seek it. There you have it. The cat is out of the bag. Prescription medications? Not needed. A permanent cure for anxiety conditions? Within your grasp. If you suffer from anxiety in any of its horrific manifestations, truly the best and most qualified person that you know is waiting for you to seek professional assistance by way of a licensed cognitive behavioral therapist. That person, always on your side, always to the rescue, when you need it most, is you. Chapter 5. The Effectiveness of Cognitive Behavioral Therapy. Cognitive behavioral therapy is an approach that addresses dysfunctional emotions behavior and cognitive processes based upon a combination of basic behavioral and cognitive principles and techniques. CBT is problem-focused, an action-oriented strategy therapists use to help patients address specific problems such as anxiety, depression, and even more complex psychiatric problems. Cognitive behavioral therapy refers to a number of structured methods of psychotherapy that center on the thoughts behind a patient's issues. One survey of nearly 2,300 psychologists in the United States found that about 70% use CBT in combination with other therapies to treat depression and anxiety. CBT is also a predominant psychotherapy paradigm being taught in psychology graduate degree programs. How cognitive behavioral therapy works. Cognitive behavioral therapy is based on the idea that human beings are somewhat irrational and make a lot of illogical errors whenever they assess the risks and benefits of various situations and courses of their thoughts and actions. This can lead to out-of-control emotions such as anger and depression. But CBT is also used to treat a variety of more complex issues such as post-traumatic stress disorder, PTSD, OCD, substance abuse, ADHD, eating disorders, bipolar disorder, among other illnesses. Cognitive behavioral therapists must have a good rapport with their patients for it to be effective, such as good communication skills and a good match in personality types. This is because patient and therapist work together to discuss the issues at hand and the patient's thinking, reasonings for his or her thoughts, and actions towards those issues. The ultimate goal is to change thinking patterns so the patient can experience fewer chronically negative emotional states. The National Alliance for Mental Health is in favor of CBT because it has excellent scientific data supporting its use in the clinical treatment of mental illness, and it has achieved wide popularity both for therapists and patients alike. A growing number of psychologists, psychiatrists, social workers, and psychiatric nurses have training in CBT. Research on the effectiveness of CBT has been found to be effective for a wide range of disorders. These studies are well controlled, the data are analyzed sufficiently, and the results speak for themselves. For example, CBT has been found to provide significant advantages in the treatment of bipolar disorder and resulting in fewer days in hospital, lower rates of suicide, and lower rates of parasuicidal or self-injurious behavior. Precautions to take before starting cognitive behavioral therapy. Psychiatrists, clinical psychologists, social workers, and other mental health professionals complete years of training and education. However, it is possible to practice therapy without such a solid training background. Some things to research before deciding upon a CBT practitioner are educational background and training, along with any professional associations do they belong to, such as the Association for Behavioral and Cognitive Therapies, where most top therapists are members. Before seeing and making your first appointment, check his or her background, education, certification, and licensing. Psychotherapist is often used as a general term. Make sure that the therapist you choose meets state certification and licensing requirements for his or her particular discipline. The key is to find a skilled therapist who can match the type of therapy with your needs. In most cases, CBT is most effective when it is combined with other treatments such as taking medications. So, in addition to your therapist, you might also need a psychiatrist for prescribing medications. Another thing to consider is the cost. If you have health insurance, find out what coverage it offers for the therapy sessions. Some health plans cover only a certain number of therapy sessions a year. Some may not be covered at all. So be sure to talk to the therapist about fees and payment options before your first visit. Chapter 6. Cognitive Behavioral Therapy, Addiction Treatment. What is cognitive behavioral therapy? Cognitive behavioral therapy addiction treatment, or CBT, is a psychotherapeutic approach, aka talking therapy, to substance addiction treatment and recovery as well as a number of other mental disorders. It is a systematic procedure that is goal-oriented and solves problems associated with the cognitions, dysfunctional behaviors, and emotions that are commonly what many addictions develop from. However, these disorders may develop as a result of becoming addicted to alcohol or drugs. How does CBT work? You will quickly discover that cognitive behavior therapy is primarily utilized to treat a variety of behavioral and emotional disorders including addiction, anxiety disorders and panic attacks, depression, other phobias. The simplest way to describe how cognitive behavioral therapy functions is that it helps the addicted individual to understand those personal feelings and thoughts that influence their behavior negatively or positively. It helps the individual to focus on a very specific problem and is generally short-term in duration. During the addiction treatment and recovery process, the individual learns how to identify and then change those destructive and/or disturbing thought patterns that negatively impact their behavior. The basics of cognitive behavioral therapy. The underlying premise or principle that CBT is based on is that our personal feelings and thoughts play a basic, fundamental role in the way in which we behave, either alone or out in society. As an example, consider the individual who spends a lot of time thinking about airplane disasters, such as crashes or runway accidents, and avoids any type of airline travel. The primary goal of CBT is that the individual can learn how to take control of dealing with and interpreting certain aspects of their environment, even though they cannot control them. In recent years, cognitive behavioral therapy addiction treatment has become extremely popular with mental health professionals and other treatment specialists. Additionally, because CBT is a short-term format, it is considerably more affordable than other types of addiction treatment and recovery therapies. It is empirically supported and has a proven track record of effectively helping individuals to overcome behavioral disorders and substance dependencies. Different approaches to CBT. Mental health professionals typically employ one of three different approaches to cognitive behavioral therapy, including cognitive therapy, multimodal therapy, rational emotive therapy. So as you can see, cognitive behavioral therapies can become very complex depending on the individual and the severity of their addiction or behavioral disorder. Chapter 8. Cognitive Behavioral Therapy for Treating Autism. Several behavioral therapies have been tried from time to time for treating children with autism. Pivotal response training and applied behavior analysis are two of the most common. But adults, older children, and teens are likely to benefit more from cognitive behavioral therapy, another major intervention to treat autism. There have been many attempts to adapt cognitive behavioral therapy for teens and older children having autism. The target has usually been on those who suffer from anxiety as well, because this is a common trait in autism. The challenge has been to find out whether autistic children have skills that are required for cognitive behavioral therapy to be a success. The response, fortunately, is in the affirmative. A 2012 study evaluated cognitive skills of older children with autism and compared them with those of non-autistic children. Almost every child in the former group had cognitive behavioral skills, and they could distinguish feelings, behaviors, and thoughts. They only found difficult to recognize emotions. Traditional cognitive behavioral therapy calls for strong language and abstract thinking capabilities, and this is often a challenge for those having autism. Researchers have realized this and have modified the therapy to suit autistic people, like making it more visually appealing and concrete and repetitive. For instance, merely asking the children to orally rank their anxiety on a scale from 1 to 10, a therapist may have a thermometer that shows the anxiety level from low to high, and ask the participants indicate the prop for illustrating this. Another strategy in cognitive behavioral therapy for autism involves focusing on a child's talent and special interests that help to keep the children motivated and engaged. and build frequent sensory activities and movement breaks for those who may have attention deficit problems with under or overreactivity. The researchers noted that cognitive behavior therapy must address social skills among those with autism because core social deficits among young persons with autism contribute to anxiety, which then goes on to intensify the teen's social problems. The therapy can be delivered in several ways, like family, individual, groups, and even both families and groups. Group therapies have the advantage that an individual with autism can see similar other people struggling with the same difficulties and trying to overcome them together. Social support and friendship gained through the process could be healing in themselves. A family behavioral therapy for autism often involves parents who educate themselves about their children's challenges. It also involves teaching them to encourage using cognitive behavioral therapy techniques when a real-life situation confronts the child. This will make them feel confident and hopeful for contributing a positive change in a child's life. Researchers have found that the issue of protecting children from a potentially negative experience is often a tough call for most parents. Autistic children usually have a history of behavioral and emotional challenges and of painful, real failures in the world. Their parents are often reluctant to expose the child to further failures, and inadvertently limit the exposure to experiences necessary to become less anxious and more independent. Chapter 9. Cognitive Behavioral Therapy. How does this method work? Cognitive behavioral therapy is a talking method or treatment for various types of problems, such as eating and sleeping disorders, anxiety problems, dysfunctional emotions, drug abuse, behavior problems, personality disorder, and mood problems. CBT uses techniques and systems as an approach to different kinds of behavioral and emotional disorders. There are a lot of methods used for this therapy, such as rational behavior therapy, dialectic behavior therapy, rational living therapy, rational emotive behavior therapy, and cognitive therapy. CBT is a two-way conversation, as the patient needs to express her thoughts and feelings while a therapist listens, encourages, and coaches the patient. The cognitive model of emotional response, that is, cognitive behavioral therapy, is a great one because its basis is that a person's thoughts are powerful enough to change her behavior, feelings, and standpoint. CBT is known as the kind of therapy that provides great results in a shorter period of time compared to other therapies and treatments. CBT is also a time-limited therapy. However, it is also a never-ending process. CBT lets a patient do tasks and therapies on her own and when she is at home. The results of the task or assignment is discussed and explained during therapy sessions. Aside from regular therapy sessions, there are many useful professional and self-help books about cognitive behavioral therapy that will help a person who is experiencing emotional distress. CBT has certain techniques and perception. Every session has a different program of plan. Asking questions is very important in every CBT session. The patient needs to ask all her questions, and the therapists need to ask the patient certain questions to be able to address some things that the patient may not be able to express, as there are times that a patient may not be able to tell what she really feels. Great approaches are learned through cognitive behavioral therapy, such as being able to change the way people think and behave. Thinking positive is also a part of CBT, which includes preventing and putting an end to automatic negative thinking. The other efficient strategies and techniques are slowing down one's talking and walking style. A patient also needs to be relaxed and calmed, as it is easier for the therapy to sink into a person's brain if he is relaxed and calm. The information provided to patients is also processed easier if a patient is not stressed or pressured. There are many websites that provide helpful information about cognitive behavioral therapy. Explanations and examples about CBT and the treatments are also posted. Situations and scenarios are provided so families and friends of people with emotional and behavioral problems will have an idea of the problem and how to resolve it. History of CBT and other studies about it are available too. In addition, blogs are available on the internet to provide helpful information about this therapy. Some websites even offer newsletters and forums about CBT so people can interact and share experiences and thoughts about it. Chapter 10: Cognitive Behavioral Therapy, a therapy that works. Do you struggle from the common colds of mental health, depression, anxiety, worry, sadness, or unexplained fatigue? Have you tried traditional counseling or therapy, but did not improve to your satisfaction? If so, consider using cognitive behavioral therapy, a form of therapy that is proven to help these problems quickly and without the side effects of medication. What is cognitive behavioral therapy? Cognitive behavioral therapy, CBT, is an evidence-based psychotherapy often used to treat depression and anxiety. In brief, CBT is a proven type of talk therapy that focuses on helping you change your behavior and thoughts to positively affect your mental health. CBT is not like the traditional form of psychotherapy, which tends to be free-flowing and can lead to endless talking with no action. Instead, CBT is focused, structured, goal-oriented, and requires you to put forth effort, all in a supportive environment. This form of therapy uses therapy homework, teaching and practicing of skills, and measuring/monitoring of symptoms. Who can benefit from cognitive behavioral therapy? Cognitive behavioral therapy is considered the treatment of choice for anyone who struggles with anxiety and/or depression, but without the side effects of medications. Anxiety in particular is especially treatable with CBT. Social nervousness, panic attacks, general day-to-day worry, and even obsessive-compulsive disorder all respond exceptionally well with this specialized form of therapy. What are the benefits of cognitive behavioral therapy? Number 1. It works quickly. With its practical emphasis on actions and exercises you can do right now, CBT brings relief much faster than traditional psychotherapy. Without proper therapy, you can struggle for years with no relief. Number 2. It is effective. In treating anxiety and depression, CBT is as effective, or in many cases, more effective than medication, considering therapy's lower relapse rates and absence of side effects. Once you try it, you will likely wish you had known about it sooner. Number 3. It offers empathy, support, and empowerment. Very often when you struggle with symptoms of anxiety or depression, you are overcome with some guilt, shame, or other difficult emotions. You need time with a professional who will listen to you and address your concerns. Experienced and qualified CBT therapists balance their meetings to provide the right amount of personal support, teaching, and implementation of skills. CBT empowers you by teaching skills you can use to support yourself even when relapses occur. You learn that there is a way out and your emotional struggles can be overcome. Locate a qualified therapist and find hope. You may not realize there are effective methods for depression, anxiety, and worry in addition to or as an alternative to medication. Perhaps you feel hopeless because you've been told that your mental health problem is a chronic condition and you'll just have to manage the symptoms. But relief is possible with the right therapy, CBT. By working with a cognitive behavioral specialist, you will be paving the way to overcome your emotional struggles and finding hope. See for yourself by meeting with a qualified cognitive behavioral therapist in your area. Chapter 11: Obsessive-compulsive disorder and cognitive behavioral therapy. When a patient is diagnosed with OCD, or obsessive-compulsive disorder, the typical form of treatment involves a combination of antidepressant medications and psychological therapy. While there are many forms of psychological therapy, the one that has been found to be most effective for the treatment of OCD is CBT, or cognitive behavioral therapy. Cognitive behavioral therapy is centered upon the theory that our thoughts or perceptions control the way we react or behave, and not our environment, situations, or circumstances. Therefore, by changing the way we think, we can also change the way in which we respond to these situations. CBT, Exposure and Response Prevention. The exposure and response prevention method utilized in cognitive behavioral therapy is used to help the patient gain control over their compulsions by exposing them to their obsessions and then having them refrain from following through on their compulsive behavior. For instance, if an individual has the compulsion of having to wash their hands excessively, they will be asked to shake hands or touch an object such as a doorknob and then refrain from washing their hands. This method has proven to be effective as the compulsive urge tends to go away after a relatively short period of time on its own. After a while of utilizing this method of desensitization, the patient begins to realize that they no longer have to act on their compulsions in order to relieve their anxiety. This type of cognitive behavioral therapy has been effective in reducing and even eliminating some of the compulsions in patients with OCD. By facing their fears, the patient also learns how to manage their unwanted thoughts or obsessions in order to relieve their anxiety. Cognitive therapy for OCD. The cognitive therapy used for patients with obsessive-compulsive disorder focuses on the obsessive thoughts that cause the individual to engage in their compulsive behavior. The unrealistic or irrational thoughts are challenged by having the patient weigh the percentages or the likelihood that the fears could actually become a reality. Once the patient has learned to recognize their irrational thoughts, they are taught the skills to replace them with more healthy and positive thoughts, and also methods of relaxation techniques that can be used to calm themselves in certain situations that have previously triggered their anxiety. In most cases, patients with obsessive-compulsive disorder will begin to see an improvement after only a few sessions of cognitive behavioral therapy. However, if you suffer from OCD, you will want to ensure that you obtain a therapist that specializes in this type of therapy for the treatment of anxiety disorders, as not all therapists are trained or qualified in cognitive behavioral therapy. It has been found that it is not uncommon for many individuals who have OCD to receive years of therapy that is inadequate to treat their condition, and has actually been known to exacerbate the symptoms in some individuals with OCD. Therefore, it is essential, if you are looking for a therapist to treat your OCD, that you research the therapist's qualifications and inquire about their level of experience in the treatment of anxiety disorders. Chapter 12. Cognitive Behavioral Therapy and Overcoming Stress. For those looking for methods of overcoming anxiety, there are a number of options available that can be considered natural. What do those natural anxiety relief methods involve? Basically, these are anti-anxiety strategies that do not involve the use of prescription pills or drugs as a means of alleviating the problem. Often, these methods prove far healthier than what the overused methods of treating anxiety deliver. One such method of overcoming anxiety is cognitive behavioral therapy. Cognitive behavioral therapy is not something new. It has been employed by mental health professionals for decades as a means of altering the behavior choices a person makes that creates the mental health issues. Cognitive behavioral therapy has not only been employed as a means of overcoming anxiety, it has been used to treat other highly serious mental health issues as well. So, what does cognitive therapy entail? Here is a brief overview of what it entails. As a form of anxiety relief, cognitive behavioral therapy involves taking a two-pronged approach to the problem. The first half entails dealing with the cognitive issues which create anxiety. That is, the thoughts of psychological components of the problem will be examined. Basically, the mental triggers that cause anxiety will be examined, and then steps taken to reverse the trigger effect will be enacted. The behavioral therapy component for overcoming anxiety is the other side of the coin. This approach deals with the actual triggers related to physical actions or activities that can cause an anxiety-based reaction. As with the mental component to cognitive therapy, the goal with behavioral therapy is to modify one's trigger reaction to activities that bring about anxiety. Some may have serious concerns as to whether or not this type of therapy can lead to noticeable results in terms of overcoming anxiety. Really, there is nothing to be concerned about because cognitive behavioral therapy has long since been proven to be an effective treatment method. This is most definitely not a new treatment methodology, as it has been employed by psychologists and other mental health professionals for great success for many years. One of the main reasons why cognitive behavioral therapy works as a means of improving one's ability to gain much-needed anxiety relief centers on the fact that most people are unaware of what causes their anxiety. In a stunning number of instances, the triggers that cause the onset of anxiety, stress, or a panic attack are completely unknown to the person experiencing the problem. Through working with a therapist, the ability to get to the core of what is creating the anxiety becomes possible. From this, overcoming anxiety becomes possible because the root of the problem is identified. Chapter 13: Cognitive Behavioral Therapy, the Current Treatment of Choice. Cognitive behavioral therapy is currently receiving a significant degree of attention as the treatment of choice for individuals needing assistance with a variety of psychological disorders. It is a structured, pragmatic approach to dealing with problems and is appealing to those seeking therapeutic treatment. People in need of counseling are seeking out clinicians who have specialized training in CBT. Understanding the reason for this current trend in popularity of cognitive behavioral therapy can be found in the unique characteristics which are pivotal to this modality of treatment. There is a simplicity and yet effectiveness in the model which characterizes the concepts of CBT. Cognitive behavioral therapy facilitates a collaborative relationship between the patient and therapist. Together, patient and counselor develop a trusting relationship and mutually discuss the presenting problems to be prioritized and explored in therapy. In CBT, the most pressing issue troubling the patient typically becomes the initial focus of treatment. As a result, the patient tends to feel relieved and encouraged that the primary problem that brought him to therapy is immediately being acknowledged and addressed. Problems are tackled head-on in a very practical manner. The patient is coached on the ABCs of cognitive behavioral therapy. The therapist explains the connection between thoughts and beliefs and their impact on behavior. How the patient thinks about problems determines the way in which the individual responds to various issues. It's the manner of thinking about life's issues that steers the patient's way of behaving. Let's assume that you work in an office and for an entire week, a coworker has walked past you without acknowledging your presence. Each day, you go back to your cubicle and wonder why this colleague is treating you so unjustly. You build up thoughts about her being condescending and snobbish and begin questioning what you might be doing to annoy her. Anger begins to emerge and you start thinking, how dare she treat me this way? Eventually you settle down and start to rationally consider the problem. You think, this is stupid. Why don't I go visit her at her office and see what's going on in her life that might be affecting this situation? You enter her office and begin starting a conversation. In the midst of your discussion, she reveals that her son is suffering from depression and needs to see a counselor. Your colleague is disturbed about the situation and confides in you that she has been on edge with everybody at the office. She asks you if you know of a qualified therapist. You give her some ideas and before you leave, she gets up from her chair and gives you a firm hug. This incident demonstrates how our thinking can be faulty and can be based upon some erroneous assumptions. CBT is effective because it teaches the patient to modify patterns of thinking, which affect behavior. CBT is a straightforward therapy which is designed to alert the patient to self-defeating ways of thinking. Locating distorted or maladaptive thinking is accomplished through an exploratory process which is dependent upon a solid patient-counselor therapeutic alliance. Cognitive behavioral therapy focuses on the patient's negative self-talk and offers practical suggestions on how to untwist one's thinking to make it more adaptive. The CBT therapist assists the client in thinking more rationally by examining the individual's spontaneous thoughts, observing ways in which they may distort reality, and ferreting out underlying assumptions or beliefs that affect ways of thinking and behaving. Spontaneous thoughts are the nonsensical things that we tell ourselves when we are under stress. I'll never get a date. Who would ever want me? Cognitive distortions are the lenses out of which we perceive reality. You'll always make me feel like a loser. Either or thinking. Underlying assumptions are the hot buttons, which crystallize as a way of coping and getting our needs met during childhood. I must avoid conflict at all costs. I hate disapproval and getting my feelings hurt. Cognitive behavioral therapy seeks to refute the nonsensical things we tell ourselves and assists us in developing more rational ways of responding to our maladaptive thought processes. Since homework is an integral part of therapy, patients will be encouraged to complete exercises designed to change negative thinking. One concrete procedure helps the client to identify current troubling events, negative self-talk, and ways of rationally responding to situations cited. The individual logs difficult situations, identifies self-defeating thinking, and refutes the negative thought processes with more rationally adaptive way of responding to events. During each therapy session, the log sheet is reviewed for patient progress. With CBT, clients are in control of their own progress. They are aware of the process that is necessary for change and diligently work at modifying faulty thought patterns. Therapeutic process is easily monitored through self-inventories and patient feedback. Time is always left at the end of the sessions to review the benefits or pitfalls of the counseling sessions. Clients are asked to assess the effectiveness of their counselor's treatment process. Patients often ask, "How long will this counseling treatment take?" Although each case is unique, 6 to 8 sessions are generally sufficient to teach clients strategies for reshaping their thinking. CBT is a time-limited, user-friendly, practical process for helping individuals to assess their negative thinking and making needed transformation in the way they respond to themselves and others. Individuals with anxiety, addictive patterns, and depressive disorders are particularly well suited to benefiting from this form of treatment. The good news is that many behavioral health disorders can be treated successfully through cognitive behavior therapy. NACBT, or the National Association of Cognitive Behavioral Therapy, is a good resource for locating counselors who are sufficiently trained, certified, and specialize in this treatment approach. Chapter 14: Cognitive Behavioral Therapy, an effective method to beat mental disorders. A little change in our attitude helps to understand and overcome adverse situations in our life. The way we behave and the way we react to situations largely depends on our own perspective towards life and situations that directly or indirectly influences our lifestyle. As a psychotherapeutic approach, cognitive behavioral therapy helps individuals to learn new skills to deal with dysfunctional behaviors and emotions. This kind of therapy is used both for individuals and groups to train them in recovering from addictions, depressions, panic attacks, anxiety disorders, and other phobias. The self-help sessions and such therapy programs helps in understanding and overcoming various disorders and alleviating symptoms. In most of the cases, such CBT is beneficial for patients who suffer from various mental health disorders and depressions, as it poses lesser risks than antidepressants and other methods of psychotherapies. In order to avail the best solutions for any kind of mental disorders through CBT, individuals should feel free to expose their worries, problems, or fears. This helps CBT experts in offering better counseling and suggesting the apt therapy or program for long-term benefits. They take initiative in comprehending the illness and its severity that may differ from person to person. The therapy focuses on eliminating negative behavior of individuals of different age groups through systematic processes. This therapy has also turned out to be a boon for those suffering from post-traumatic stress disorder, insomnia, anxiety, eating disorders, obsessive-compulsive disorders. The concept of cognitive behavioral therapy evolved in early 1960s, a combination of behavioral and cognitive therapy. CBT focuses on the beliefs and thoughts that influence the mood and attitude of an individual. The therapy facilitates one's thinking process to be more healthy and adaptive and tries to change unhealthy behavioral patterns. Any environmental factors or past experiences influence one's perspective of any given situation. Often, this view is distorted, and that makes them react to situations with an irrational response. The very first step in CBT is to teach people to analyze the troubled situations with complete clarity in order to adopt the right and appropriate reaction. CBT, or cognitive behavioral therapy, offered by professionals, helps in providing complete relief to patients from behavioral and emotional responses that leads to disturbing situations. This therapy comes to play when a person consciously analyzes, interprets, and manages his or her thoughts. As feelings and thoughts are interwoven, individuals find better control over their emotions. Anyone who wants to control the thought process can apply this technique and reap maximum benefits. CBT, though a lengthy process, is very effective and hence worth all the efforts. Hence, it is an incredibly popular treatment program that helps people in recovering from a great variety of disorders, right from depressions to panic disorder and bulimia. If you are looking for a sure solution to your stress, disorders, or depressions, look for CBT therapy specialists. They can guide you in being more positive in life, relieving you from all sorts of anxieties with ease. Chapter 15: Cognitive Behavioral Therapy and Medications. If you have an anxiety disorder, a basic question that you may ask yourself is, how do I get better? If you happen to bring this up to your doctor, they are very likely to prescribe you a drug without even mentioning the most effective, scientific validated treatment around, cognitive behavioral therapy, or CBT for short. Over the past 20 or 30 years or so, scientists have discovered several principles that help people overcome their fears. These principles have to do with how thinking affects or colors emotional responses and how specific behaviors contribute either to helpful and adaptive emotional responses or painful and difficult ones. These principles contributed to the formation of a new type of therapy called cognitive behavioral therapy. The cognitive part, which means thinking, works by teaching people to change harmful, overly fearful, and non-realistic anxious thinking into more positive and realistic ways of thinking. The underlying assumption is, if you change the way you think, you will change the way you feel. The behavioral part works by teaching people to engage in behaviors that have a calming effect to reduce anxious arousal, and by learning new behavior to face rather than avoid fears through a process of therapeutic exposure to the fears. Cognitive behavioral approaches for anxiety disorders are superior to medication in reducing anxiety and preventing relapse. Still, most Americans have rarely heard of it, and since many medical doctors do not have ready access to this approach, medication is often prescribed for anxiety disorders. Let's take a look at the major classes of drugs used to treat anxiety disorders. There are two main classes of medication most commonly prescribed to treat anxiety: tranquilizers, a class or grouping of benzodiazepine-based medicines like Xanax, Ativan, and Valium, and antidepressants like Prozac, Paxil, Zoloft, and Wellbutrin. There are many more as well. The most recent research suggests that while benzodiazepine medications work faster, there are many problems associated with their usage, including addiction and anxiety rebound when they are discontinued. Plain truth is that drugs are also associated with a variety of unpleasant side effects: weight gain, sexual dysfunction, like difficulty achieving orgasm and loss of desire, dry mouth, headaches, gastrointestinal distress, and many others. Weight gain and sexual dysfunction are particularly common. Another significant problem with all classes of drug treatment for anxiety disorders is that once the drug is removed, the chances of a relapse are much greater than after a successful course of cognitive behavioral therapy. The simple truth is that drugs only work while you take them. If you learn specific coping skills through CBT, they become a part of you for the rest of your life, resulting in significantly reduced anxiety even after treatment has ended. Cognitive behavioral approaches to emotional problems have been shown repeatedly by rigorous scientific studies to significantly reduce panic, anxiety, worry, and fear in a variety of well-controlled studies. It has now been demonstrated that for certain anxiety disorders, including panic disorder and agoraphobia, that these approaches have better outcomes and far less relapse than medication. Again, when you go off the drug, the symptoms at some point usually come back. Most people are unaware of these findings because medication is by far still the most common treatment for anxiety problems. Unfortunately, per above, medication does not teach skills. Brain imaging studies have shown that after people underwent a course of cognitive behavioral therapy, they experienced a decrease in the fear center of the brain. Chapter 16: Characteristics of Cognitive Behavior Therapy. Cognitive behavior therapy, or CBT, is a form of psychotherapy that is effective for a wide variety of problems in a person's life, like depression, addictive behaviors, anxiety, relationship problems, bad eating, OCD, and bipolar disorder. CBT works by changing people's thoughts and beliefs, cognitive, and their dealings, behavior. CBT includes a variety of approaches that include rational living therapy, RLT, rational emotive behavior therapy, REBT, cognitive therapy, CT, rational behavior therapy, RBT, acceptance and commitment therapy, ACT, mindfulness-based cognitive therapy, MBCT, dialectic behavior therapy, DBT, behavioral activation, BA, functional analytic psychotherapy, FAP, cognitive behavioral analysis system of psychotherapy, CBA-SP, and integrative couple therapy, ICT. Despite this diversity, most cognitive behavior therapies have the following characteristics. Number 1. CBT is based on this idea that cognition causes of emotion and behavioral responses. A person's way of thinking creates their feelings and behaviors, not outside things like events, situations, and people. Therefore, if we can change our thoughts, consequently our feelings and behaviors will change. Number 2. CBT is time limited. A course may be from 6 to 20 sessions. It will depend on several factors, like the type of problem, the features of client, therapist experience, and etc. But in the client's opinion, changed thinking habits is the most important factor to end CBT sessions. Number 3. To learn coping skills. CBT has more skills for solving our problem. People don't learn a skill just by reading and listening. Learning and be master of any skill requires hard practice. To learn good thinking and appropriate dealing with problems is like to learn swimming skill and surfing. When a person learns them, not only they don't fear the ocean and waves, but they enjoy them. Number 4. CBT is collaborative, structured, and goal-oriented. CBT is a collaborative effort between the therapist and the client or group members. The role of therapist is to listen, observe, teach, and motivate, and the client's role is to talk about his or her problems, learn, and practice. Sessions have a structure, and every session has specific agenda. Therapists help the client for achieving selected goals. Number 5. Doing homework in CBT. Homework is recognized as a vital part in CBT. Learning CBT skills takes a long time. Homework is planned according to the type of problem and the client's futures. Number 6. Individually or group session. CBT can be done on a one-to-one therapy or with a group of people. Advantages of group cognitive behavior therapy can include access to social support, increased cost effectiveness, and increased motivation. The end.